The other thing that happens is that if we're able to prolong the time frame where we're seeing the cases, interventions are coming on stream as we speak. So we're discovering treatments that are effective, vaccines are being developed, logistics is being perfected. So with a flattened curve, there is a greater chance that patients with COVID-19, particularly those with complications, will survive, as opposed to us seeing patients at a very short period of time where we are overwhelmed, we don't have access to the treatment that's coming out from research, there's not enough time to expose people to vaccines, and the overwhelming nature of the number of cases we'll be seeing will mean that we'll have more fatalities in this short period of time. So I hope that's clear, that flattening the curve gives us time to plan, gives us time to introduce treatments, creates the opportunity for possibly a vaccine, and definitely allows the health structure to cope with the number of cases. These are the projections in terms of modeling. The red line is the projection we would see if there were no interventions. In other words, if we did nothing, we would see a very steep rise with thousands and thousands of cases, if not millions of cases. In the blue line, if we just did isolation, contact tracing and isolation, we would see a significant decline in cases because we're interrupting the transmission between individuals. In the green line would be case definition, isolation, and social distancing. And that's what we're doing right now. The green line there would mean we would see much fewer cases because we're contact tracing, we're identifying, and we're isolating. And right now, Lagos is still utilizing that strategy. Our mission is to case identify every possible COVID-19, to isolate them, and to perform contact tracing. There's a fourth line, the black line, and that's the lowest of the lines. That's the preferred trajectory that we would like. The fourth line has an added component, and that component is community ownership, where Lagos State is putting all these strategies in place, but if the community are not compliant, and if the community do not take ownership alongside with government, then we will not see this completely beneficial flattening of the curve. So the government is putting out policies, the government is putting out information, the government is putting out guidelines, but if the community do not join hands and synergize with government, then we will not see the true benefit of all these strategies. Let's talk a bit about the projections. As of the 30th of March, this red line demonstrates the projected trend of the number of cases we're going to see in. You can see there that the red line is rising progressively with this slope. As of today or yesterday, you can see that the slope has bent downwards and that we're seeing a slightly lower number of cases per day. We can't tell what the long-term projection will be, but this is certainly encouraging data. what has been seen in other locations is exponential rise of cases. And we are seeing a flattening of the trend. When you combine these two gradients together, this was the original trend of last week, and the red line is the trend of this week, demonstrating that we've been able to flatten the slope of the curve, or as I described earlier on, we've flattened the curve. If we carry on with this strategy, we will indeed see a flattened curve and an improved capacity of the state and of its infrastructure to manage this outbreak without too many casualties or fatalities. Generally speaking, this is the trend in Lagos State. From our index case on the 27th of February, we were able to contain that case completely. There was only one transmission from that Italian gentleman. Subsequently, so that was a dead-end infection. One imported case transmitted to one person, both of them fully recovered, and them transmitted to anybody else. That index case was from Ogun State. Lagos had its first index case on the 18th of March, and subsequently we had a series of imported cases, mainly from Europe and the United States. We introduced case definition, contact tracing and isolation, and social distancing around the 18th of March. And the trend began to flatten at that point. Our strategy has continued, and we've increased our social distancing awareness, and you can see that there are several points at which the curve is beginning to bend downwards, or the trend, as we describe it, is beginning to flatten. If we had not put these policies and strategies in place, this is the projected modeling that we would have seen in Lagos, while in fact, this is what we are experiencing. This trend, by now, represents at least over 40,000 cases. In reality, we are just seeing slightly above 100 cases. So there's a big difference between the number of cases we would have seen if our strategies were not working, as opposed to the cases that were seen as a result of the multiple interventions that were put in place in Lagos. This is very encouraging for us. It means that at the moment, we seem to have control of the outbreak. We have not peaked, but it is rising at a pace that we can manage and cope with. Let's look at some data. Passengers of interest, we had 2,645. 352 of them have completed their 14 days isolation, and we're still following up 2,293. In the next few days, most of these will exit their 14 days isolation. We're following up 32% at this point, and 68% will exit follow-up anytime from now. Passengers of interest are the persons that have flown into Lagos on a flight where we have identified a confirmed COVID-19 patient. The risk being that being on that flight with a confirmed case, you have been exposed, and there's a possibility that you will manifest with COVID-19. This slide shows you the amount of alerts that we're receiving. In the red is alerts from the public that are diverted to Lagos State from the Nigerian Center for Disease Control. In the green are alerts that are received directly to our Corona, 8,000 Corona number, the Lagos State number. And in blue is individuals just phoning me or my permanent secretary or members of the Ministry of Health alerting us of suspicious cases in community. Out of all these alerts, we have completed and closed down cases of 95% of these alerts that we've received. 4% of those alerts are not reachable, and 1% is still ongoing. So 95% of all the alerts that we received from these sources have been dealt with effectively, and the situation closed out. A breakdown on the alerts or the phone calls. In the top box, you will see that 80% of the calls we receive to Corona, 8,000 Corona or 8,000 Corona, are hoax calls. People calling in to test the number, people calling in to make pranks, and people calling in with aggressive language. The 80% of calls are blocking our call center lines and unfortunately making it difficult for the people that really need help to get through. I'd like to use this opportunity to appeal to Lagosians or anybody else that's trying to use those numbers. This is a matter of state and national security. The Lagos State government is trying its best to open up its channels to the community. If you phone us for fun or for pranks or to insult our staff, you're actually doing a disservice to the people that actually need help. 11% of the calls received are welcome. They're asking for information, and they're given information that is satisfactory for their awareness and knowledge. Only 9% of the calls are actually valid calls. Calls that are received from members of the community because they feel that they have a concern. Those 9% are demonstrated in this lower box. While they are valid and require reassurance, only 4% of those valid calls actually results in a red flag. A red flag meaning we need to dispatch members of our team to either test you or to retrieve you to our facilities. So you can see from this data that very few calls are valid, and of those calls that are valid, very few actually meet our criteria for intervention. We are very disturbed about the hoax calls and the prank calls, and this is a waste of resource, and it's the main reason why people are complaining about not being able to get to our call center, because our lines are being jammed by irresponsible members of our society. I'd like to give you some laboratory data. This graph shows you by local government the number of tests we've performed per local government and the amount of positivity in red. So blue demonstrates the number of tests we've performed per local government, and the red bar demonstrates how many of those tests are confirmed COVID-19. you can see that the peaks are in Etiosa, Ikeja, and Lagos mainland. So for example, we've tested 350 people from Etiosa, of which about 10% have been positive. There is a low-lying activity going on in the other local governments, but we are becoming a bit concerned with Alimosho, and I'll give you more data on that in a minute. This slide shows the difference between week 4 and week 5. So we are in week 5 now, and the red was week 4. Week 5 is in blue. You can see that Lagos mainland has gone up from 11 confirmed cases to 19 cases. In Ikeja, we have not seen any new cases between last week and this week. Etiosa has seen a slight increase from 47 to 50. But we're seeing some activity here, even though it's low-level activity. We've seen an increase of 1 to 4 in Alimosho. This may represent a low level of activity, but in line with the density of that local government and the number of people in that area, we're going to divert some of our activity in terms of surveillance, awareness, and information to the local governments around Alimosho. This kind of data is very helpful to us as it helps us to plan and diversify our strategies and our energies. Let's look at some case management. I've already told you we've had a cumulative number of 120 cases in Lagos as of today. We have 87 active cases. 31 have been discharged, and we've had 2 deaths. This graph shows the changing profile of transmission. At the end of week 4, majority of cases had a travel history, 82%, while 18% had no travel history. As of the end of last week, the number of cases without a travel history has increased from 18% to 45%. That demonstrates that there is more and more local transmission going on, and importation of cases is decreasing. Importation of cases will no longer happen through international flights, but it may happen through marine vessels or through our land borders with neighboring countries or through interstate boundaries. However, the important information to take away from this is that local transmission is now happening in Lagos State. And the sooner we know about cases in community, in other words, what we define as red flags, the sooner we can come to test you, or if you're unwell, the sooner we can come to admit you to one of our facilities, so that we can contain you and prevent the spread, and also at the same time manage you professionally. So far, 93% of our cases are Nigerians, with 77% foreign nationals. 93% Nigerians, 7% foreign nationals. Our age distribution on this graph shows you that the peak is between the age of 30 and 39, followed by 50 and 59, and then 40 and 49. So most of our cases are between the age of 20 and 60. We've seen very few cases above the age of 60, and we've only seen one case below the age of 10. Once again, most of our cases are male, 67% are male, and 33% are female. This slide shows you the location of our current and proposed isolation facilities. Our main active facility is the mainland hospital in Yaba, our infectious disease hospital. We have a total bed capacity of 124, and we're currently at 60% capacity. As we admit patients, we are also discharging patients who are fully recovered. So we're able to cope with the current trend without stretching our Yaba facility. However, because we do not know the long-term trend, we are developing backup. We have the next center to be opened will be tomorrow at the Onikon Stadium. That facility has 100 beds. It will be open to receive patients, and the staff have been trained and given the necessary equipment and preparation to start receiving patients in Onikon. We will manage mild to moderate cases in Onikon and divert complicated cases to Yaba. The opening of Onikon will take a lot of pressure off the Yaba facility and allow the staff there to have a bit more time to manage their cases and improve the clinical attention that the patients are receiving. So the yellow dot here represents the Onikon Stadium on the island of Lagos.